80% of the burden faced at the orthopedic department at Mulago National Referral Hospital is trauma, followed by other infections. It is against this backdrop that the Orthopedics Society of Uganda is calling for more employment of orthopedic specialists in the hospital, since health facilities lack them.
We would need that even those who have qualified need to be absorbed. You'll be surprised that we've got several orthopedic surgeons running around the private hospitals to make ends meet, and yet you have got regional referral hospitals, you've got district hospitals that have got an immense burden of disease, but the job is not available for them to go and set up there and help that needy community. So that is also something that we'd like you to.
The experts say that in their department, they do most of a range of procedures with minimum referrals abroad, and all attributed to specialized services they offer. Orthopedics say that the environment they work in is full of constraints and urge the government to look into their issues, like training, availing implants at subsidized rate, among others.
The equipment we use for orthopedic surgery is very pricey. The equipment we used to do joint replacements, we used to do spine surgeries, to do trauma is very pricey. The implants that we use cost a bit of money. And unfortunately, if you're looking at the patient side, these equipment, most of it is not readily available at the hospitals, and patients have then got to buy it out of pocket if they are not on insurance. They buy it out of pocket. For somebody who is paying out of pocket, this can cause some delays. So imagine somebody has had a fracture and needs about a week to mobilize money to buy an implant. That is time lost, during which time other complications can happen.
The experts note that the main challenge at their department, patients report late for treatment, making it hard for full recovery. It should be noted that only 73 orthopedics are in the country, and out of which 22 are at Mulago National Referral Hospital, and the rest distributed to other hospitals.
Less than 20 of those actually have orthopedic surgeons practicing in their hospitals. So, for example, Kabali, like you mentioned, has one surgeon. Masaka, one surgeon. Barara has one surgeon. Jinja also has one surgeon. Lira Regional Referral also has one surgeon. And the district hospitals do not have any, and yet we know that these are the ones that are going to see most of the patients that get trauma primarily before they are sent to the regional referrals or eventually to Mulago.
To be frank, the bodas are the biggest contributors to this trauma that we have. So we have a lot of trauma. Trauma takes about 80% of the work in orthopedics department currently. And then we have a lot of degenerative condition, that is wear and tear, mainly involving the spine conditions and the joints. The joints, where we have to replace, give artificial joints, do repairs of ligaments and spine surgeries.
In the concluded surgical week held at Mulago National Referral Hospital, over 1,200 outpatients were catered for, and 126 major orthopedic surgeries were conducted. Zahara Abigaba, UBC News.